The number of U.S. women who died within a year after pregnancy more than doubled between 1999 and 2019, with the highest deaths among Black women. Now, this is according to some new research that's out. There were an estimated 1,210 maternal deaths in 2019, compared with just 505 in 1999. To the researchers' surprise, Black women had the highest maternal mortality rates, not in the South, but in some Northeast states. Well, let's talk, Dr. Hill, about this study. I mean, these studies come out year after year that continue to show that the maternal deaths amongst Black women who birthing, women who give birth. Why can't this country figure out how to keep Black women safe and prevent us from dying as a result of childbirth?
Well, I want Dr. Carter to answer this. I'm going to say really shortly. We have, in so many ways, we talk around the true issue of racism, and it's fundamentally that there are elements in white society that are truly indifferent to Black people and Black suffering. And until that changes, a lot of the systemic racism that is in this country won't really change. That's me thinking as a historian about American institutions and just how racism has the changing same of American racism. Like, there's a true indifference to Black people and Black life that is near constant to me because of the ways in which racial violence has been, not uneven, but constant throughout our past. And so for me, that is the deficit. We got to talk about that before we talk about anything else, right? The true indifference to Black people and Black suffering. And then we can talk about that maternal. We can talk about the mass shootings that are happening in the Black community. We can talk about all, but the indifference is to Black people, not to these different issues.
No, I think you're right. At the heart of it, it is, we are just othered. We continue to be othered in this country. So whether it's maternal death rates or mass shootings or college admissions, we can just go down the list. But Dr. Carter, the women, when we saw that track and field star just recently, she was in the news, lost her life. Baby born, a stillborn baby, and then having all those other track and field stars come out to talk about the difficult nature of their birthing experiences, and just keep hoping that one of these reports comes out with some good news. And I think the most shocking news in this report is that it's not the South, where we typically think of these maternal death mortality rates being the highest. This report says the Northeast has a problem.
Everywhere has a problem where Black women are concerned. I mean, when you look at the lives that Black women have to live and just accessing general care, right, for sometimes chronic diseases like hypertension or diabetes. But then when you add where people have to go to get maternal care, whether it's available in certain parts of your city, certainly in Washington, D.C., right, there are women in Ward 7 and 8 that are underserved, right, who are delivering children or people who are having children who are underserved in this city with so many resources. So it's not surprising to me that this is a global phenomenon. I'm sure it's worse in some parts of the South, like Mississippi, Louisiana, Alabama, your usual suspects. But, look at Newark, right? Look at New York City, look at DC, like Detroit. This is a nationwide problem. And I think Karlos is exactly right in terms of talking about the indifference to the pain and to the suffering of Black women. You talk about the track star, but Serena Williams, right? These are people at peak health who are wealthy, right? At least in Serena's case, she has a wealthy white husband and almost died doing something that most people take for granted in this country every single day. And I had a cousin who almost died delivering a baby post-labor, right? Because nobody took the chance to look at her and why she was so swollen. And when they checked her blood pressure, she could have had a stroke at any moment. And they sent her home. So it was only because an older Black nurse saw her and said, "You don't look right." Did something happen? She never had a child before. She didn't know. And this, I cannot imagine, doesn't happen to Black women routinely. And we know when we have practitioners who are not Black, they are not paying attention to us in the same way. It's systemic. It's the stress that we have as people, but it's also the lack of training that happens in medical professions every single day, and the indifference. When Black women say, I don't feel good, people don't believe them. When Black people say, I'm in pain, people don't believe them. And they send them on their way, and they want them out of their way for various reasons. So I think there's a lot that needs to be done if we are serious about saving the lives of Black people who are trying to have children.
Yeah, no, everything you said, that part, because you both, spoke to that issue so eloquently, and we got to do better. I mean, at the end of the day, we just have to do better by Black women.